Well, I think what we're really all waiting to see is we can, I think, all agree at this point that patients who achieve an MRD negative state, particularly those in whom it's sustained, seem to do particularly well. And what it still remains to be shown is, can you create an MRD negative state through your treatment, whatever that might be, whether it's transplant or a triplet or quadruple regimen, whether you can produce that MRD and then sustain it and show that you are actually keeping these patients from needing additional therapy. Now, one of the things that I think we will be seeing in some of the presentations is, not surprisingly, some people with higher risk myeloma. So there is a presentation on looking at double hit myeloma and plasma cell leukemia. Those patients have less of a chance, it looks like, in going into an MRD negative remission, although some of them do. So I think besides trying to see if MRD really is what would be termed actionable, that is something that we want to try to achieve in every treatment that we offer patients, whether converting a patient who we would consider a high-risk myeloma patient to an MRD negative state actually improves their outcome in the long run. And of course, we certainly hope so.